And so what are some of the common symptoms that will bring a prenatal patient in? You know, somebody who's pregnant. There's also those people that see a midwife, and the one thing that I really love about that is that they're very proactive, and they understand the dynamic, like when you're delivering a child, how important the function of the pelvis is to be able to pass a baby through the birth canal. So our moms that are pregnant and seeing midwives tend to come to us a little bit more. We get a lot of referrals from that, but speak to some of the pregnant population out there of why they might want to come in.
Yeah, absolutely. So the biggest thing during pregnancy is to try to keep you as comfortable as possible and keep the baby, in a position where he has enough room to move around in the pelvic inlet outlet, and so that you do have a smooth delivery. And so a lot of things we'll take a look at is subluxations in the lower lumbar spine and the sacrum. We want to make sure that those SI joints are moving really well as any trigger point or round ligament pain that you may be having. So if we address those two issues coinciding with each other, a lot of times, for instance, if I have a mom comes in and she's breech, say transverse breech, so baby's not in good position, just kind of laying across the tummy, we want to get them by 7 months to where baby's starting to turn and go head down, so you can have a natural delivery if that's what you're seeking to do.
Yeah, so you would encourage people to come in ahead of time rather than late. So some people might think, well, gosh, I'm going to deliver here and now in 2 weeks. It may be a smarter idea to come in sooner to allow us the opportunity to follow them and guide them through and work with them through their pregnancy to ensure uncomplicated pregnancy and uncomplicated delivery.
Prenatal supportive care is tremendous. It makes for a happy, healthy pregnancy, and also makes for a happy, healthy birth process. No matter what the plan is, if we can support the nervous system for both the mom and baby through regular chiropractic care and get, like you said, get the breech headed in the right direction and so on and so forth, gosh, the birth process just simply, it's just so much more easy and happy for the baby and mom.
And I think it's important to just highlight the fact that we're not actually turning the baby, we're just allowing the mom's pelvis and hips to come into alignment to where she's in a place where that baby can turn.
Yes.
And so I think that's one thing sometimes that gets confused in chiropractic care, but we're just making basically an atmosphere conducive for the baby to be happy and be able to have as much movement as possible going into that final time for birthing.
Yeah.